Welcome to OTC Medicine Safety. My name is Taylor, and with me today is Rachel, Jake, and Hannah. Today, we are going to talk about the responsible use and disposal of OTC, or over-the-counter, medicines. So why is over-the-counter medicine safety important? Research shows that children begin to self-medicate around the age of 11. When not equipped with the knowledge and information to make safe choices, adolescents may end up doing more harm than good. Many think OTC drugs are safer than prescription medications, but all medicines can cause harm if not used appropriately. If we're not equipping ourselves and our families to make safe choices regarding OTC medicines, mistakes can happen. For example, in 2013, poison centers managed over 250,000 exposure cases involving children ages 6 to 19. Over half of these cases involved medication errors and misuse. Also in 2013, poison centers have reported approximately 70,000 cases involving medication dosing errors in children 12 and younger. Education is important, and we need to facilitate that education in our community and in our classrooms, whether virtual or in person. So, what is a medication? A medicine is also a drug. A medicine or drug changes a chemical process in your body to treat, prevent, or relieve the symptoms of a disease. Medicines can do things as simple as make you feel better when you have a cold, or as complicated as treating a serious disease like cancer. Now everyone, think about you or someone in your family who has taken an over-the-counter medication this week. Think about what reason they may have taken that medication for. Okay, great. Some examples you may have thought could have been for a headache or for allergies.
Let's take a couple of minutes to talk about the differences in over-the-counter medicines and prescription medicines. Prescriptions are prescribed by a doctor or nurse practitioner for one person. They should only be used by the one person that they were prescribed for. They are bought at a pharmacy and dispensed by a pharmacist. Now let's talk about over-the-counter medication. You can buy these without a prescription. They are bought off the shelf in the store or pharmacy aisles. They may be used by more than one person in the family for the same symptom or problem. With both prescription and over-the-counter medications, your local poison center or a healthcare professional can answer your questions about these medicines. They are both dangerous to abuse or misuse. The medicine label, including the directions, must be read and followed carefully before use. Finally, children should only use medications with the permission of a parent or trusted adult.
While a lot of Americans, statistics say 91%, read some portion of the drug facts label, only half say they seek out the packaging label for usage information when they plan to take over-the-counter medications for the first time. The label provides important information about the medication, including a list of active ingredients and important warnings, in addition to the medication's inactive ingredients. Every medication is unique and has a certain set of characteristics that enable it to treat specific symptoms. The drug facts label appears on all over-the-counter medications, from mouthwashes to toothpaste to pain medications to eye drops. Ask yourself the question at the bottom: what would happen if you only read part of the directions on a test? What about a recipe? In these cases, you may end up with a bad grade or a bland cake. Why is it important to thoroughly read the drug facts label before taking an over-the-counter medication? The uses section describes the symptoms that the medication will treat and will include specific language such as temporarily relieves coughing due to minor throat and bronchial irritation, if the medication treats this type of symptom. Look in the warning section to learn about other medications that you should not use with this medication, side effects the medication may cause, when you should ask a doctor before taking the medication, and other important safety information like when to stop taking the medication and to talk to a doctor.
If someone is taking more than one over-the-counter medication at a time, it is important to be very aware of the active ingredients in the medications. No one should take two medications simultaneously that contain the same active ingredients unless instructed to do so by a doctor, pharmacist, or other healthcare professional. The drug facts label tells us the name of the ingredient, how much of that ingredient is in each pill or teaspoon, what that ingredient does, and its uses. Some medicines also have a questions or comments section on the drug label that provides you with the drug company's phone numbers if you have any specific questions or comments. In the other information section on the label, you'll find other things that you need to know about the medication, such as how to store it. Storing medicine safely in your home is very important, and we'll get into why in a little bit later. The directions section on the label tells you the amount of medicine or dose you can take, how often you can take the medication, and how much you can take in one day. This section will include important information about the appropriate dose you should take, and safe dosing is critical.
Safe dosing. Have you ever used a household spoon to take medicine recently? Or something other than the dosing device that came with the medicine? You should use the measuring spoon, cup, or syringe that comes with your medicine. This is the most exact way to measure your dose. Always measure carefully. Accuracy is important when it comes to taking medicine or when giving medicine to family members. Always use the measuring cup, dropper, or syringe that comes with your medicine. This is the most exact way to measure your dose. When the recommended dose is not followed, medicines may not work the way they are supposed to, or result in an overdose. If your medicine doesn't come with a special measuring tool, ask for one at the pharmacy. Silverware or a household spoon may hold the wrong amount of medicine. Make sure the tool can measure the right dose. Check the markings on the tool to be sure.
Keep medicines out of the reach of young children. The younger children in our families, our little brothers and sisters, might think that certain medicines taste really good. They aren't candy, and medicines can harm children if they take too much. Every year, nearly 500,000 parents and caregivers call poison control centers because a child got into medicine while unattended. Now let's take a look at how candy and medicine can be mistaken for each other. Here we see two pictures of white tablets. Can you tell which one is candy and which one is medicine? Did you get it right? The tablets on the left are actually Tums. What about these? They look pretty similar, right? The picture on the right is actually a medicine. You don't want to take that one. Here we see two yellow tablets. Which one's candy? Which one's medicine? The tablet on the right is actually medicine, and it can be really dangerous if you take a lot of it. These both look pretty good, right? Well, only one of them is something you can eat. In these two pictures, one of these is very sweet. The other you cannot eat. You're a real smarty if you can figure out which one of these is candy. That's right, it's Smarties on the right. The left is aspirin. Any kind of medicine or vitamin can cause harm if taken in the wrong way. Even medicine you buy without a prescription. Walk around your house and find a storage place too high for a young child to reach. Never leave medicine out on a sick child's bedside or in the kitchen, even if you have to give it again in a few hours. Always put every medicine and vitamin away after you use it, including those you take every day. And try to buy medicines in child-resistant packaging when it's available. Always relock the cap on a medicine bottle. If the medicine has a locking cap that turns, twist it until you hear a click or you cannot twist anymore. Remember, even though many medicines have safety caps, children may be able to open them. Always store every medicine and vitamin up and out of a child's sight.
Over-the-counter medications are available for purchase without a doctor's prescription. While these medications are easy to buy, they can be harmful if misused. In situations where we're required to take over-the-counter medications regularly, it is important that we're cognizant of safe medication practice and behaviors. These can be simple to adhere to, like safe storage and safe dosing. Even if we take medication daily and it's part of our daily routine, we may make errors in dose and dosing frequencies. Let's pledge today to take medications responsibly and to do our part to make sure that those around us in our community are doing the same. Let's make sure that we're also leaning on our healthcare professionals in our community as a reliable, go-to resource for questions and concerns.
Next, we will take a quick quiz to practice our medication safety skills. So, is it dangerous or safe to take more than the recommended dose? How about redosing more frequently than directed on the label? Taking medicines for reasons or symptoms other than what is directed on the label? Is it dangerous or safe to use more than one medicine with the same active ingredient at the same time, or to take medicines for longer than directed on the label? The answer to all of these questions is dangerous, because there are very real and potentially dangerous consequences that can happen when someone misuses over-the-counter medications. The drug facts label provides information on how to use the medication safely. Over-the-counter medications can be harmful if misused or not used as directed on the drug facts label. Here are 6 important tips to remember. Never share your medicine with anyone else. Never use someone else's medicine. Know the active ingredients in your medicine and never take more than one medicine with the same active ingredient. Always read and follow the label every time you take medicine. It is never safe to misuse or abuse prescription or over-the-counter medicines. Only take medicines under the guidance of your parent or guardian. Over-the-counter medications need to be treated with the same care as prescription medications. Ask your doctor, nurse, or pharmacist if you have any questions about your over-the-counter medication. Always use the dosing device that comes with your over-the-counter medicine. Over-the-counter medicines should be put up and away and out of sight after every use.
Now, if you had a treatment question or an inquiry about an over-the-counter medication, or you needed quick advice in the case of an emergency poisoning, call the Poison Helpline at 1-800-222-1222. There are 55 poison control centers in the United States. Each provides free 24-hour professional advice to anyone in the 50 states. Poison centers provide poison expertise and treatment advice by phone. All poison centers can be reached by calling the telephone number 1-800-222-1222. Poison centers are staffed by pharmacists, physicians, nurses, and poison information providers who are toxicology specialists. Annually, of all the calls to a poison center about a potential poisoning, more than 70% of calls are managed on-site and outside of a healthcare facility, meaning that the caller got the help they needed over the phone and didn't have to go to the hospital or a healthcare provider. This makes poison centers a key resource to safely reducing the cost of emergency room visits and to lighten the load on an overtaxed healthcare system. Thank you for your time today from all of us at UT College of Pharmacy.